Welcome to Star Cares, a weekly program that delves into the issues that impact you and your family. This program is a public affairs feature of this radio station. Now here's your host, Michael Leach.
With nearly 90% of Americans being vitamin D deficient, and as we continue into the darker winter months, absorbing vitamin D from sunlight is even more challenging, especially for those with darker skin tones. Our guest today stresses the importance of having your doctor test your vitamin D level so that you know exactly how much vitamin D to supplement with should that be necessary, especially since everybody's body processes vitamin D differently. Joining us today is medical doctor, Dr. Ken Redcross, author of Bond, the 4 Cornerstones of a lasting and caring relationship with your doctor. Dr. Redcross, good morning and welcome to Star Cares.
Good morning, Michael, and good morning, everyone out there. It's great to be here with you today.
What motivated you to write Bond, the 4 Cornerstones of a lasting and caring relationship with your doctor?
Well, because I realized at this point, Michael, that really healthcare was changing. It was focusing more on volume than value and the value of the patient. That's my sort of calling card, is that patient-doctor relationship. It's my passion, and I think patients should be treated like gold, and I thought that the healthcare system was sort of changing that, and I just felt that I had to do what I could do in my little space to try and make a big difference.
And so you believe that we should really have convenient access to a full spectrum of healthcare services and holistic and wellness counseling. How can we find doctors like you that think the same way? Help us out here.
The important thing, I think, is to look in that mirror and recognize that your health matters. You're the boss. So when you come into the doctor's office, let's make sure you can get that relationship where you feel like you're being heard. I think that's one of the important things. A lot of people will go to the doctor and think that they can't ask questions, but I say it's just the opposite. When you're going into your doctor's office the morning before for that particular appointment, get a little bit of a list together. Go in with a game plan of some things you want to check off on your list that you want answered that's going to really make you happy and let you know that someone else, the physician in particular, is invested in your health.
And so the impact of COVID-19 has really changed that dynamic, right? The dynamic of just calling and going in and speaking with your doctor. How have some things changed that you've seen on your end, and how can we mitigate through these changes?
Oh, gosh, that's a great question. So as you mentioned at the top of the segment, I am a board-certified internal medicine physician, but I'm a concierge physician. So my practice is totally mobile. I make house calls. I come to you when necessary. I mention that because since COVID started really back in March, or at least really started to impact us here in New York, it was difficult for patients to get out. Everyone was afraid to obviously go to the office. We also knew that we had to be inside. We had to social distance. And so it's been even more important to have this discussion, because as we talk about vitamin D today, it used to be simply just go to your doctor's office and have your vitamin D checked. But now it's not so easy. We need to be a little creative. And so, I'm able to talk to patients about a particular website called thepowerofd.org. I mentioned this particular website because you can order an at-home test kit. So in a sense, it's very kind of concierge-y. It's something you can sit in the comfort of your home, order it, have it sent to you, get your test done, send it back, and get the results. So it's once again trying to figure out how can we navigate the healthcare system right now when we know there are some challenges about getting to our doctors at this time.
Why is vitamin D so important to the coronavirus conversation?
There's a message for everyone out there. What are the disease states that we see that the coronavirus is affecting? Those with high blood pressure, or in other words, heart disease, lung disease, diabetes, obesity. These are things that are very commonly a part of what's going on here in America. And these are the disease states that the coronavirus is really preying on. And it's like I said, this is a message for everyone, but especially the minority communities where you see that African Americans are dying at 2 times the rate of Caucasian Americans. Why is that? Once again, we're looking at these disease states that are common in that particular community. And if you look at each one of those disease states, guess what? They're associated with vitamin D deficiency as well. So vitamin D is not only about bone health, it's also about our immune support. And that's where vitamin D is getting really talked about a lot when you're talking about the coronaviruses or other viruses, of how to really build our immune system up to where it needs to be.
Is there any data showing that vitamin D helps with COVID-19?
There was a great study, a correlation study out of Indonesia, that showed that those people who had vitamin D levels that were less than 19 was associated with almost 100% mortality. Those who had levels that were over 34, there was 0 zero mortality. Now, this is not a discussion to say that, hey, everyone, vitamin D treats the coronavirus. Of course not. But what we do recognize is that vitamin D has a role and a part in what we need to do to stay well while we're still trying to battle the coronavirus and even influenza that's circulating as well. You know, I joke around because I have this kind of platform that I'm talking a lot about when I say, get on my level. And when I say get on my level, everyone, it's my vitamin D level. I want you to know what your levels are and make sure they're between 40 and 60. Mine is 65, but I want everyone out there to be able to have dialogue with their friends and their family and challenge them to get on my level between 40 and 60 as well, to get the optimal healing that vitamin D can help with.
Earlier you mentioned the powerofd.org. Tell us a little bit more about what we can find when we go there.
When you go to that particular website, there's a lot of great information about vitamin D. A lot of people, as I mentioned, think it was just about bone health, but it was even better that I was excited to share with patients. Go there because you can learn even more about why vitamin D is so important to help support our immune system. They talk about omega-3. They talk about magnesium. All of those particular supplements are important. So I am a Western-trained physician who trained right here in Columbia, over here in New York. But I also learned about the alternative ways of healing, and that's where vitamin D nestles in so perfectly to really make a big difference.
Can you share with us what you think has contributed the most to the spikes that we've seen in the COVID-19 deaths?
We all know the three important things, right? The social distancing, the washing our hands, the wearing the mask. But we had a little blip in the radar, especially when it came time to Thanksgiving, where we were thinking we were getting a little bit of a hold of this, and everyone was like, you know, I'm going to see my family at all costs. And I don't think we had a good central message for all of us to recognize that we weren't quite out of the woods. So exactly what Dr. Fauci mentioned and the other specialists happened when he says, look, if we go on Christmas or on Thanksgiving, we're going to be okay for that moment, but look another couple of weeks and these things are going to spike, these numbers. And that's exactly what's happened. So I think we kind of fell asleep at the wheel a little bit. We had a little discrepancy about the importance of masks with some people in the nation as well. But I think it's starting to become a little more common knowledge that if we're dealing with a respiratory illness, then it kind of makes sense that you keep the mask on to make sure that you're not spreading anything, even if you're asymptomatic. Now, obviously, we have some vaccination options that I think are going to make a really big difference as the summer and spring come.
In addition to the mask wearing and washing hands and various hygiene options, and of course the vitamin D, what else are you speaking to your patients about by way of recommendation to stay healthy, especially during these times?
I always say that food is medicine, and I really truly mean it that way. For instance, I talk a lot about eating fatty fish. Fatty fish is great for a bunch of reasons, but it's important for our omega-3 levels, which is healthy fish fat in essence, has been shown to be very beneficial for our heart health. The other thing that's important as well is to move your body. Exercise. Exercise is incredibly important because the CDC says we should be getting 150 minutes of moderate exercise or 75 minutes of strenuous exercise. Once again, it's about keeping that heart healthy. And the other thing that's important, too, while we're dealing with this coronavirus is the mental aspect. Being able to have a team around you, meaning your family, a medical provider, someone to where you can bounce ideas off and really start to focus on what's important for your spirit. What can we do to still be happy? We're stuck in the house for a bit, but I promise this too shall pass. And so we just need to kind of all come together as a community to make sure that that's also discussed.
Talk to us about the impact that stress can have upon us.
Stress is a kind of a hidden secret, everyone, because stress is something that in our society, we tend to think that, you know, that stress is like, oh, I'm working so hard, that's why I'm stressed. No, stress is not a good response. Stress is only beneficial in that acute phase. If you see a big tiger run in the room, great, you run away. That's a good stress, right? But it isn't a good stress when it becomes more chronic. It becomes a part of your life. And with stress comes inflammation, and with inflammation comes disease. And that's what we want to always avoid. So you always have to have that discussion of, am I really stressed, and for how long, and what can I do to get rid of this? Which goes back to those things that you enjoy doing, whether it be exercise, whether it be meditation, whatever those things are, you need to hang your hat on those and recognize, you know, I need to dial back right now. Life is this beautiful experience that we all have. Let's not waste our time that we have here being stressed out about about things that lots of times aren't really that important or that we can control.
Talk to us about hydration, the importance of good water intake.
We talk a lot about that. In fact, I have a wonderful colleague of mine, has a great book out called Quench. She talks a lot about how important water is, but not just water that we all drink, but water in our foods as well. And so you have to recognize that 60% of our body is actually made of water. So we need to make sure we're getting that in. Then I'll have some patients who will say, well, doc, I'm not that big of a water fan. What else can I do? And that's when I talk to them about coconut water, because coconut water is a pure source of water that's healthy. It has electrolytes and is incredibly important. So we want to get those 8 ounces of water. They say usually 7 to 8, but once again, that kind of depends on what you're doing activity-wise, I find, as well. So I'm glad you brought that up, because water is very, very important. And once again, if you want to deal with fatigue or even manage weight for some people, water is important in that. Like I said, I've had a good discussion with a colleague of mine, Dana Cohen, a book called Quench, about that in particular. So it's a great read.
With all that's going on, there are a number of us who are talking about how we're just not able to sleep well.
I tell everyone jokingly, turn off the TV. Don't watch the news. That's one of the first things. But look, we're supposed to be getting 7.5 hours of sleep each and every day. And as you pointed out, it's a little elusive for a lot of us. It's very challenging to get that right amount of sleep. You know, I mentioned exercise more than once because that's a good thing that can also not only help with stress, can also help with sleep. But then you need to think about your sleep hygiene. When I say that, you know, you're supposed to kind of cut off your computers, cut off your iPads, that sort of thing about an hour and a half before bed, because that light kind of keeps you up as well. So there was a study that showed that if your bedroom was closer to 68 degrees, which I know is a bit chilly for people, it resulted in better sleep, a better sleep hygiene. The other thing you'll hear about, too, is avoiding having a television in your bedroom, because once again, your body doesn't quite understand that it's time to cut off. It thinks it's time to kind of cut on and watch something on the television. So a lot of the things when we deal with sleep also can be related to stress, and that's what I tend to hear a lot of people, especially around these times. And meditation, guided meditation is helpful as well. So when you're trying to get that right amount of sleep, once again, that goal is 7.5 hours, everyone, is what you need, because your body needs that in order to kind of deal with the insult that it was fed throughout the day, whether that just be you going through your day or whether that be stress and so forth. And the lack of sleep can affect our immune system as well. So we need to make sure that there isn't this one little thing. We need to pick from each side and put them all together in a beautiful combination to make sure we're getting all the rest that we need.
Dr. Redcross, what kind of education do you think that we need around the COVID-19 vaccinations? People are not sure whether or not they should take it. It's not been long enough. There's not been enough tests. Get it immediately. Wait for more results. So much information. Help us out here.
Well, this is a great question here, because so as we're talking today, everyone, we have 2 vaccines. They use a messenger RNA. It's a very special technology, so very, very innovative. We have a couple of more coming too, probably by the end of February. Now, this is an important discussion to have, because you have certain people, for instance, in the African-American community, where there's a lot of skepticism. I don't know if some of you listening have ever heard of the Tuskegee experiment. This is way back in 1972, but it was a horrible experiment that was done within the healthcare environment. And even back then, it was all these years ago, almost 40 years ago, but even now, that's still within the African-American community. So that's one part of where the discussion has to start, to say we have to build trust. The healthcare system may have had some challenges back then, but this is a different time, and we have to bridge that gap. The other thing we have to do is explain to everyone that this vaccine is a little bit different, the 2 that are out. It uses that innovative technology which does not inject you with the coronavirus. In fact, it almost fools your body into thinking that you've already seen it, so that if you do truly see it, your body is ready to go because it has some antibodies already waiting there for you. I've had questions, Doc, this vaccine, usually I heard it takes 10 to 11 years. How did we get this one so quickly? Well, we've never had $19 billion to put towards a vaccine, Michael. This sort of focus around the world has made such a big difference. And then the other question I get to about the side effects. I had my vaccine, everyone, my first dose 2 weeks ago. I feel great. The only thing I had was a little bit of a sore arm, and that's what you really hear from most people. So thank God it's shown to be a vaccine that appears to be very effective right now. And once again, not too many side effects in my world, at least. I know that there's always things that are reported, but, when you look at the side effects of the vaccine or what the disease can do to you, you have to have that really, kind of coming to Jesus discussion with your doctor and say, is this good for me? What should we do?
Where can we get more information about what we've spoken about today?
Dr. Ken Redcross, that's my handle, whether it be for Instagram or Facebook or Twitter or what have you. And if you want more information on vitamin D, it's thepowerofd.org. And remember, I challenge everyone, get on my level, and that's my vitamin D level between 40 and 60. So let's make sure that we have a discussion around with our families and make sure that we start to get to know what our levels are moving forward.
Dr. Ken Redcross, thank you so much for joining us today.
Thank you for having me on. Stay well, everyone.
And thank you for listening.